Hello, everybody. I hope some people are watching already. Hi, I am Monia slash Debleena, and with us today is Dr. Soumitra Datta. He is a psychiatrist at Tata, Tata Medical Center at Kolkata, and he works primarily with cancer patients and their families. Welcome, Dr. Datta, to this show that is hosted by iNovoCare, and we
Thank
will be.
you.
Thank you so much for being here. And we'll be discussing today uh, something that is being discussed a lot nowadays, but it's never enough because, as we all know, it's the time of COVID-19, and we are all super stressed for several reasons. Uh, Dr. Dotto, would you like to say something about it to begin with? I have collected some questions from people my age or younger than me.
Well, I was speaking to an academic a few weeks ago, and he said one of the reasons for stress is, this incessant demand for webinars and being present in that. So that in itself is quite stressful for many people who actually have to, who are studying or have to be on the screen all the time. But there are other real issues, for people to be stressful. Some of them could be the effect of the lockdown, like we are going through
Mhm.
today. So, in the population, some of them could be related to the people who actually test positive, and they're, afraid of, contracting complications of the disease COVID-19, or passing on the infection to other family members. The third group of stressors is around, it has been very difficult the last few months, particularly because a lot of us have lost close friends, colleagues, or family members. So that is also an area of stress. So these are the broadly the areas of stress which people are talking about.
Mhm. Absolutely. So I'd like to bring up first something that has come up in our conversations a lot recently. It's lockdown time, and we all have to be at home and all the time. And we generally say that home is a safe space, but as we know, home is not a safe space for everybody. And it also matters how much actual physical space somebody's home has. So there is a lot of sharing of that space, and even gadgets are being shared for classes and meetings and work, and so which leads to uh, some issues with privacy, and also the need to accommodate everybody without having any me time or any off time to oneself. So could you tell us a little bit about that? What are the
Yeah, of
implications
course.
of
Yeah,
that?
like individuals grow, and we are by and large a social animal. So we would like to interact with people outside our home because we that's where we have grown up with, and it's like uh, safe space from which you explore the outside world. So it is stressful. Lockdown is stressful for two reasons. One is that we can't go outside and do things which you would like to do, and uh, other things is what happens when you are inside home. So
Mhm.
on a lighter note, if I talk about things which you cannot do on in the particularly, I think it's poignant for everybody, but young adults like yourselves, um, I stayed quite near to where I grew up and where I studied the medical college, but I convinced my parents that I need to stay in the hostel because that's where apparently you can study, which was not true. We did anything but studying at that time. So and I can imagine things which people are missing out, that they aren't able to explore. Yeah, I wouldn't take a judgmental viewpoint about what youngsters explore because that's how life is. But uh, I think that's something where you people are facing that they're having boundaried existence. So that's a stress. On a serious note, I think lots of people, particularly women around the world, are facing increased domestic violence. It's true that it's true for children as well, for both genders, to have physical or emotional abuse, which are commoner than sexual abuse. So these are very real issues. So
Mm.
I think, these are, excuse me one second.
So once again, we are discussing about COVID-19 and how it is affecting our existence, how it is stressing us all out. And Dr. Datta was just talking about uh, the
Sorry.
abuse people face at home,
Yes,
children
yes. Thank you.
especially.
Thank you, Debleena. Yes, yes. So my phone rang up, bad preparation. So I just tried to, silence it. So these are again, and it could be related to these domestic violence. And, most violence actually are faced from people inside home and from intimate partners actually around the world. And that this statistics during COVID, if you know, check the data available around. So this is true for US, for European countries, and India, where 1 in 3 women in the Western world would have faced some kind of domestic violence, which is even more in Indian and context. And I think uh, it is a real issue. It could be also quite linked to substance use in the partner.
Mm,
Having said that, violence towards men is often under discussed. It's not
mm,
discussed, and I have seen, being controlled by, partners, even for men. I remember, I can tell you a story. So I was driving with a friend, and he stopped to get petrol in his car, and he bought petrol for, something like 450 rupees, which was amazing. I mean, why would anybody, a doctor, buy 450 rupees of petrol? And then I realized, and he used his card. And then I realized he was married to someone. He was not from Calcutta, luckily. So he was married to someone who could actually go to the internet and check the bank account and see what her husband has spent. So that, I would say, controlling somebody's spouse's behavior from a distance. And this poor guy would every day buy petrol for 450 rupees, and for 550 rupees he would spend anything else. He was a doctor. So I think intimate partner relationships are very, very bizarre, the way it can
mhm.
pan out. uh,
Yes.
I really felt bad for him, so. And in the pandemic, none of these protective mechanisms can work because you are
No.
always there.
Yeah.
And you are being watched, like Big Brother is watching you, like 1984. And also, because you don't have the freedom of going out if you are getting upset.
Mm,
So, in friction, if one person leaves the situation, often the temperature comes down of the communication, whereas
yes.
that isn't possible. So people, I presume, there is no hard data yet that they are becoming physical. And one of the things your audience might be interested in knowing is that, how to spot that there is domestic abuse. So, somebody who has suddenly become silent and not talking or interacting with friends what he or she would be usually expected to, or whenever you see that person are wearing long sleeved clothes, and nothing to do with me wearing short sleeves t-shirt today, but just making a point, because people actually try to hide their bruise
Mm,
marks, etc. And if they actually say that there is abuse. So in UK, one of the things that people tried was that when you are doing a Zoom conference, irrespective of everybody, you just have a standard gesture, something like this, where the
mm,
person on the other side would be able to make out that whoever is talking is facing some kind of difficulties and abuse at home, so that some protective steps could be taken up. So making an universal sign language gesture which makes the other people in the Zoom conference aware of your predicament. So these are some of the things which people are talking about.
That is very interesting. I didn't know that. And I would pick up from a thread that you just mentioned that men are also abused, but that's not necessarily brought up as much. I think the whole issue of of men's emotional health is less discussed. And interestingly, when I posted for questions for this conversation, I got all the questions from women, not a single question from a man. And I wouldn't say that men are not facing problems in the COVID
Yeah,
situation.
that's true.
Would you say
Meaning,
something about that?
I think, yeah, meaning I think gender nowadays is a very fluid concept. So maybe we should not categorize world into men, women. That's quite passe. And in fact, data shows that in adolescence there is fluidity in gender quite a lot. So I think this is a situation where I have worked in forensic psychiatry in UK and in India a little bit, and forensic adolescent psychiatry as well. And there could be situations where everybody is a victim, because the circumstances or the social milieu under which a young boy or a girl grows up to become sort of in a position where he or she is abused is quite traumatic as well, because poverty, the social circumstances around, the social milieu, the locality, all of these have some associations. Not to say that people from upper social strata or other areas are not abused. Everybody is vulnerable. So I think one thing which is quite common in UK context is that anybody who works with children should be trained in um, at least identifying child sexual abuse, and every child matters. So I think things are changing in India as well. In the last 10 years, there have been a lot of talk, and people are coming, child labor, and how to deal with that, how, what are the legislative frameworks, because those are important as well. So I think if we become an inclusive society and try to empathize with who has been abused, and have a way to be able to not, so broken lives do not necessarily where you are broken. There is a very nice quote by Hemingway, something, we are all broken at some places in our lives, but some of us become stronger at those parts which we are broken. So I think people in general have to be able to given the opportunity to grow. You can have immense resilience. So domestic violence, of course, or any abuse, that has to stop. You cannot do therapy while the abuse goes on, so that has to stop. But at the same time, um, after it has stopped, you need to be able to reconcile to the past and be able to move on and process those memories, and of course, after your physical injury and things like that have been taken care of. So a domestic violence, and sometimes if you approach it slightly indirectly with sort of targeting the substance use in the partner, or targeting poverty, I think those do work.
So I'll move on to the next point that I had. But since you mentioned gender fluidity, I'll just bring this up. I have LGBTQ plus friends who are especially facing a problem during the lockdown, as there is still a huge prejudice against LGBTQ plus people, and uh, there are people who have not come out at home, but they have a life outside of home which they now can't have. So, would you say anything about that?
Yeah, absolutely. Because lack of acceptance in the broader world, although things are changing towards the better, I think these are again quite real issues. And I think it is possible in today's world to remain connected, especially in a sort of platform which is smaller and support each other. So I think that's something which I would recommend, because you may not be very comfortable talking to everybody else about, about your gender and sexuality, and come out, as you would say, and that's not uncommon in our country, or for that matter, a few years ago, maybe the entire world, people were quite secretive about it. So I think the fact that the unique position of LGBTQ is that the stresses which people face because of the orientation, or gender orientation, often people feel supported if you feel supported by a member of your viewpoint or community, which in this situation may not be available. So I would recommend, online support, checking on how people are and things like that for the time being. And then, this is a long road ahead, so has to be marched slowly.
Okay. Thank you for that. I am like taking a leap, going into another topic. One of the things that I'm hearing a lot about is that sleep routines have been disturbed. So we don't have a specific work routine. A lot of us who are working from home do not have a specific work routine, and a lot of us who are not even working from home, it's difficult. Like there's anxiety issues, and sleep has become a difficult thing for a lot of people. So if you'd say something about that.
Yes, I think absolutely. As soon as your regular routine breaks, if you're at home, whereas um, so the commonest sleep problem in the world is circadian rhythm problems, and it often happens in adolescence, because you tend to stay up till late, and um, you get up late, and you can get away with that. Now, with the onset of the lockdown, that has started for many people. Many people are sleeping very late, and because you have to work longer hours, because what you could achieve in face-to-face interaction often is taking longer time, be it teaching, be it meetings, or doing other things, if you do it online. And I think that's why the work day of many individuals have stretched from mornings at 10 o'clock till night 10 o'clock. And some of the employers are also thinking that, now you don't have to travel, so you might as well work for 3 more hours. So, I have got feedback of similar feedback from my patients. And I think that's incredibly stressful, because, you need to, be able to look after yourself. That also takes time. So cook and look after the children, and children are not going out. If you have children, they are not going out. If you have pets, even if you have plants to water, so work life demarcation has become very sort of blurred now. And because people are sleeping late, often your inherent body clock gets distorted. So I would say that a few things which you could do is, avoid having caffeine in the evening. These are called sleep hygiene techniques. So avoid having caffeine in the evening after 8 o'clock or 6 o'clock, whatever suits you. And then try to exercise every day. So exercise lifts mood. So it could be exercise inside home, or if after the lockdown, if you could have a walk around. And have a sleep routine such that you go to bed and at a particular time, not have your WhatsApp on, or phone nearby. So people even keep their telephone in a different room.
Mm.
So no, don't go to bed with, while looking at your phone, because that light often actually, you know so one of the things which shift work people like us, who have to doctors, who have to work in the nights, people recommend is that you have a dark room. So have heavy curtains if you're sleeping in the daytime after a night shift, because that's how our brain is programmed. So the light of the phone often actually hampers your falling off to sleep. And you could read something boring. Having, now it's summer, so having a bath before going to bed also is very, bath in a lukewarm water. And the scientific basis for that is that when we sleep, our body temperature naturally falls. So if you have warm bath where the temperature is slightly more than the body temperature, you're artificially simulating a situation where the body is cooling down after you're coming out of your bath, and that helps sleeping. There was, some suggestion having a warm drink before sleeping, like, whatever suits your fancy, Horlicks or milk or whatever. So these are some of the routines you could do to, and not have your dinner immediately before going to bed. Have it a couple of hours before, and if you don't fall asleep, get up,
Mhm.
read something boring, and go to bed when you fall asleep, and don't sleep in the daytime. And you try that for the next 2 3 days. So what will happen, you might end up going to bed at 2 a.m., but you have yourself made a routine that you'll get up at 8. So next day, you'll daytime you'll feel very sleepy, but don't sleep. So you are restructuring your circadian clock such that you make yourself tired, so next night you might sleep at 12. So if you try that for 3 4 days, usually your sleep will get back to the normal rhythm. I would avoid medications if possible for this sort of a problem where you're just having sleep problem but you're not feeling low or low mood. Sleep being fragmented could be a sign of depression, but that's a different discussion. I'm talking about just a sleep problem where you're not feeling low or anxious but you can't sleep.
Yes, and since you brought up screens, uh, so we have to switch off the gadgets sometime at least before we go to sleep.
Shall
So
I?
we have to switch off the gadgets, you said, or keep them
Yeah,
away.
no, that's okay. Yeah, yeah,
Yeah.
yeah,
But that's so difficult. And till a few years ago, people used to say that don't look at gadgets, engage with people. And now gadgets have become a life raft. So if you have to engage with people, you have to do it through a gadget because you can't meet them face
yeah,
to face.
yeah,
So, uh, like I, right now, personally, I read a lot on a Kindle because it's impossible to buy that many books. So, and it's easier on the Kindle, and you can just switch off the light and read there. But it's a screen, and I don't think I am ever off the screen, and that is true for a lot of my friends. So, and it's both for work and for entertainment. So, when I'm working on my computer. When I am taking a break, I am watching something on my computer. When I am reading on my Kindle. When I am contacting somebody, I am on my phone. And uh, except for all these, there are few family members I can interact with face to face. But except for that, the whole world I have to go through a gadget. So, what would you say about that?
yes. I think you're absolutely very poignant about it. So, too much of anything is bad. So little bit of many things, I can't talk about all the things which people do at I did when I was of your age, uh, but I think too much of anything is bad. So um, I think your point is that we connect through the gadget, and I wouldn't want to be old-fashioned and say that all innovations and information technology and networking is bad. Today is we live in a world where I collaborate with my collaborators. This was even before COVID, through Zoom or through Microsoft Teams, and then you could work on the same document through cloud, save them. Nowadays almost we store everything in the cloud, and so it doesn't matter. You are sitting, this meeting we are having, you are sitting in Kolkata or in Toronto, we could still have it. We have to do it in the right time, of course. So I think there is immense advantage in having networking, but and with using the online tools and gadgets. But as long as we don't forget that it is the human being behind it which is what matters. So when you read a book by Kindle, on Kindle, I myself read a lot on Kindle. Um, it is written by people who who would be writing about, mostly about, other human beings or interactions of human beings with machines. you know
Mhm.
have you read Machines Like Me, a book which was
Yeah.
published a few years? So a protagonist actually gets infatuated with an AI based robot, and it was
Okay.
very nice way it was, this thing. And I think that's an age where we are living in, and life follows that. We can't fight it. So as
Yes.
long as we keep a balance about it, I think that's what matters, and balance is important in everything.
Yeah. That- yeah. It's absolutely true that people and gadgets are not mutually exclusive anymore.
Mm.
So that is something we have to keep up with. But I also wanted to ask you, since we are talking about screen time, I'm going a bit haywire with my questions, but
Sure.
I'm
No
just
problem.
following this stream. Um, since we are talking about screen time, I have got some accounts from college students, especially that, and especially students who have never been part of the offline college experience, that online college or online school is getting very tedious with all the cameras closed off and long classes online, and it's very difficult to concentrate for a lot of people online. So is there any way out from that?
Yes, I think there are few problems here. One is that, like every skill, you need a bit of time to get acclimatized to it. Now, I used to teach on, I still teach on in University College London, and I couldn't actually be in London every time I deliver a lecture. So I was using Microsoft Teams through the UCL account for the last many years, and I realized that it requires for you to modify your teaching strategies a little bit. And I think those who are teaching also need some inputs on how to do it well. I have seen people trying to juggle a phone, the lighting is poor or the audio quality is poor. And I think those are things which makes learning much more difficult. So that's one thing. And secondly, I believe that in a good learning experience, you just need to give short bites, or if you call it a snack. So the idea is to collaborate online and make breakup rooms and ask the students to discuss rather than didactic lectures, because I think that gets very boring online. So if you imagine yourself in a classroom, you don't look at the lecture all the time. You look at the guy next door, and you see what is he writing, and then you sort of eye the other girl sitting behind you or the boy sitting behind you, and then you sort of see the idiosyncrasies of the teacher, or the institute. Sometimes you might just doze off or read your own stuff. These are realities of life, what happens. Now in an online session, what people are doing is that either they switch off the video or they are pretending to listen. And I think both parties, is sad. Like, why would anybody sort of force anyone to learn? If you teach well, you would anyway learn. Then I think if it's a bit more interactive where you teach, I think learning becomes more of an exploration. And because it's online, you could actually not be restricted by the only lecturer you are having. You could signpost them to other online resources where they could click and see. Like today, the whole world is front of you. You could learn um, in masterclass about economics from a Nobel laureate in economics, and it wouldn't cost you that much. So I think online teaching has its immense amount of benefits, but as long as the teachers are and the students both have an expectation which is attuned to the um, to the situation. You are doing theater, so like I always say that Hamlet is a theater. Now, when you actually shoot a movie from Hamlet, you need to adapt it. So similarly, the form make is very, very important rather than the content. The content and the form both are important. So the way Hamlet picks up the skull and talks to it, with the light falling, the theatrical aspect of it is very difficult to be reproduced in a film. So so similarly, the form has to be taken seriously.
Yes, and I just got a few questions here. So that is why I was a little distracted, but we'll get to them later. I uh, I I wanted to ask you this. This is very good advice for teachers, and I face this all the time. Like even in in-person class, this is very good advice because like teaching is moving a lot farther than just one-sided lectures. But what do we do as students, especially when in an education system where we do not have much say about how the teacher teaches and we are just expected to listen? So what do we do there? And secondly, this is both about screens and about this teaching, this educational situation. uh, a lot of people are also saying that they are uh, like we were just saying that how gadgets and people cannot be mutually exclusive, and younger people have adapted to this better than older people, mostly, like generally speaking. And I have people who were saying, like asking me to ask you about this, that their parents are unhappy about the fact that they're socializing online and not spending all the time to study. So maybe if you could say something for the parents and for the young people, especially more younger people, 16, 17, 18, who do not have any say to how their teachers teach and how they.
Yeah, meaning I think, fair enough. I don't think only 16, 17. I think in most parts, unless you are in a sort of parallel system of education, I think uh, very few students have a say in how the teachers teach, unless you're in a system where the teachers actually are rated by the students. And there are universities where the promotions would depend on the feedback of the students. I think that's far too sort of radical to be accepted. But if you see today's world, we all go by 5-star rating. The Uber driver wants you to rate 5-star. So it's just a time when this will come. This will be a disruptor, the online. People will not stay in the lectures of somebody who is not, from where you don't gain enough. Now, I think the secret to someone, the also, but to be fair on the system, you have to learn things which you are not very comfortable with, because what you are good at, you might score better anyway. But if you have 5 subjects and you really don't like a particular subject X, I don't want to point anyone, but and that teaching, you are being told, so it could be related to your liking of the subject and also the person who is delivering the teaching. Unfortunately, in education, you do need to have a well-rounded, you can't set your own syllabus. So you need to be sort of spending more time on things which you don't like if you want to be strategically right about scoring better. So that's something which I would do, but at the same time not be too much focused on numbers, because at the end of the day, I think all the good marks, like know if you go through, doctors folks, they have taken innumerable exams. So, and I think at the end of the day, if you ask today's patients what kind of a doctor you would like to see, they would say somebody who is empathic and is able to connect and listen to their problems, and be able to get rid of the problems which they have come to. So they are not necessarily going by the accolades which people might have developed. So similarly, yes, in the short run, someone might not do very well, but it's all right. Failure is very important in life. Unless you fail and you adapt to how you have failed, you wouldn't know how to succeed. And nobody just has success. So it's okay not to do well for a few exams. It's not end of the world. So I think that's what I would say to 16, 17-year-olds, and even older ones. So that's my take home message for anybody. Exam evaluation systems are not necessarily geared towards has a very good outcome, a correlation to what you would finally turn out to be.
Yeah, it's a miracle that I'm a PhD student now, given how many tests I have flunked because I just didn't like them. So yeah,
Very good. Thanks for sharing that. And that's true for many people who have done extremely well in life.
Mhm.
You know, Steve Jobs dropped out of college, and you can have so many examples. Einstein failed in the maths exam in school. There is a very good sort of documentary called Genius. It talks about Einstein's childhood and all that. So I think you need to be. I'm not saying that everybody who fails will become Einstein. That's true. There is a very good book by Bertrand Russell called On Education, and he gives an example of Rabindranath Tagore being not having conventional education, but the influence he has had was immensely nurturing of being in the milieu he was in. So I think that also matters. But
Mhm.
the performance doesn't necessarily have a correlation with the outcome
Yeah,
in the class 9, 10 exams.
yeah, and this is something that like parents should pay heed to as much as the students, because I was very lucky. My parents never even asked me to study. Like I could do what I want, but I think a lot of the pressure comes from the parents in case of many students. So
Yes.
yeah, I hope they pay attention to this. And I will turn to a more difficult topic that a lot of us are facing now during the COVID, and it's like there is almost no family who have not had somebody fairly close to them go away during COVID. Uh, so bereavement, and there have been so many deaths that we do not quite know how to mourn them. And
Yes.
uh, bereavement is an issue, and so is the fear of death. So which is always there, but in the COVID time it's something we do not yet understand how it gets spread. Like I know it gets spread by air and whatever, but it's no I do not know a specific way in which I can protect myself or keep myself at peace.
Yes.
And
Yes.
yeah, some people are very afraid of the disease and death. So yeah, and
Yes.
the death of close ones as well. So
Yes, I think this is a fair point which you have said, that the suddenness of suddenly people passing away, where you are not expecting someone to die, and you unable to say goodbye because of the COVID positive. The person who are close to them might be positive and isolated, and lack of the ability to engage in the sort of after death rituals, which is there in every culture and religion, and even for atheists. So I think these are all risk factors for complicated grief, and that's what we are seeing. Um, Somewhere down the line, if you look at, we are from India, and this is a country which which has given rise to a lot of religious thoughts and spirituality in the world. So Buddha, Hinduism. So Buddha's teaching talks that Jora Badhi Mrityu, so suffering is inevitable, and death is, of course, an outcome. I think in the last 200 years, death has been um, sort of acceptance towards death has come down, because we don't see people dying at home, dying in peace with their family around, whereas that was the norm 100 years ago. And I think that's why there is an inherent conflict. I work in a palliative medicine department, so we do face death and dying. And I think, as though as much it is unfortunate to suddenly lose someone, but it's important for us to focus on the people who are alive after the death and be able to move on. Now, in grief, things which you could do is that we tell that you could write a letter to the person whom you have lost as if the person is alive, and then maybe put it on a river, or give it some ভাসিয়ে দেয় অনেক সময় নদীতে বা ধরো um, you could discuss about the loss within the close community who knows about death, about that person death. So be it online or be it in the family, not avoid the topic of somebody losing. And then it takes a while to get through this emotions of why me, why have I not died. So there could be survivor guilt. And the worst thing which could happen is sometimes people are losing their children, where the elderly parents are alive but the younger person have passed away. So you cannot deny the fact that it is an incredibly painful time, but we have no control over that. We can't do much. We don't know exactly how the each individual reacts to the virus. The same virus may make people differently react to it. Some people don't have any symptoms, some people might be in ICU and drop dead very quickly. However, international data does show that very few people, proportionately of whom are contracting the disease, a very, very minuscule proportion die. The second thing which the message to go is that all pandemics have ended. There is no one pandemic in the world which has gone on and on and on. So I started by reading Plague by Albert Camus, and it's very, very similar what was happening in the initial part of the pandemic around the world. Also, being getting to know, because today it's a globalized world, and you get to know the horror stories which are happening in any part of the globe. So you may not benefit by knowing the nitty-gritty updates of what's happening in a place which is very far removed from you. So I think this information seeking, incessant information being bombarded to you is making people stressed, and the deaths and the pyres looking at. There are, Indian Psychiatric Society, of which I am a member, have also appealed to journalists and media to portray sensitively what's happening around, because it's affecting people. So I think looking after yourself, looking after, if you can find some way to remember the person you have lost, having conversations with the people around you who knows the person, so be it online or offline, and then trying to accept that death is a reality. We have to accept it. It is not a switch that will happen in 6 months or 3 months. You may take a long time for to come to that acceptance, but that's life. There are good and bad both in life, and you won't appreciate the light unless there is darkness. And ask for help if there is a difficult time. I would say that ask your friends, family members who are around if you are not feeling good. There is a threshold at which you need to have professional help for bereavement, but I think medicalizing grief is also not a good idea. So I think you try the social means of grieving. If you are really really upset and you are unable to cope, you're not sleeping, you're feeling suicidal, not able to function even after a few days of the loss, of course you should consult professional help, a psychologist, a counselor or a psychiatrist. Those avenues are there, but thankfully most people are able to reconcile their lives without professional help. That's the reality of it.
Mm. Yeah, it is difficult to accept that the reparation takes so long, and maybe it's never quite done. But I would follow up with you mentioned the media. So I actually know a lot of people who are feeling extremely anxious during this time, and they're constantly following news channels, which is making them more anxious. So,
Yes.
what would you say about that?
Well, I think news channels do have a responsibility of to portray what's happening. Um, but the best way is embargo and controlling the news is not necessarily a solution. However, you may want to, because that's not something which you can control, you know
Mhm.
but you may want to focus on the news to the extent where you get the information you wanted to, be it weather or other things, and then have a update every second day or every day. It depends. There was a cyclone, so at that time you needed to I needed to know when the rain would be and when I would go to the hospital and things like that. I had been to hospital every day, including the day of the cyclone. And and that is true for even when Amphan had come. So there is a tangible way the information I get from the media I would use. Whereas um, you know getting into the information mode where what's happening to when in the initial days, say Wuhan province of China, about what is the nature of the pandemic, having an hourly update would only sort of stress me out. And that's exactly happened actually. I have a commentary published in the American Journal of Society of Clinical Oncology, JGO, Global Journal of Oncology. Even before the pandemic had hit, because we were globalized, a lot of us actually had got this information and we are waiting for the inevitable in a very stressed out way. So I think this is not helping. So you need to be preparing for difficult times, but not necessarily anticipate that you would be personally in the most difficult spot, because that's anxiety.
Yeah. Uh, we are sort of at the end of our time, but I have two more questions, and I I am trying to like uh, put all the questions together to make them really big questions, which is not a good idea. But yeah, I'll just ask this too, and then so there is a lot of since we are all online all the time, children are not being able to go out and play. So children, especially younger people, are missing out their unique ages, because I don't know this if this is theoretical, but I feel that after 25 it's sort of the years are all right. But like I'm 30 now,
Yeah.
and yes, and but when you are 8 and 9 are two completely different things. So what would you say to people who are growing up, like 18, 19, even that is a very growing year? And there is a related question that there is a lot of parents are worried about children missing out, and children are worried about missing out, and even older students are also worried about uh, missing out on experiential learning. So
Yes.
what would you
Yeah,
say
I
to
get your
this
point.
whole
So
situation?
a class 12 student might be thinking that I won't be able to do physics practical because I'm not going to the labs, or engineer might not be sort of confident that the field trips he or she would have required is not possible. I would say that learning is a lifelong process, and the learnings which you have benefited from because of being thrown into the deep end of the pandemic would be more valuable than what you have learned in the closed confines of four walls. And yes, those are things which you might need to pick up those skills by doing it later on. But you would have, even if you don't want, you would have had some learning which is vicarious in this situation of the pandemic. How do you cope in terms of limited resources? How do you help each other? How do you network when you are, innovate in a situation where you don't have the gadgets? And I think these will stay for life. And so I think, instead of thinking this as a missed opportunity, I would say this is a unique opportunity for learning. I have seen people sort of bonding better within teams. I sometimes interact with between juniors and seniors. Sometimes junior members of the team are much more empowered because they are at the forefront making decisions, so they would become better leaders and strategists in future. And people also are learning a lot online because lots of universities opened up to give information. So somebody who's curious, you need to be remain curious, and then I think there is immense opportunity to learn,
Mhm. Yeah.
even learning
So
about your emotions.
I just got a question in my inbox, and this is a question that I can very much relate to because even a few years ago, I was working as a freelancer myself. So this is a difficult time for everybody, but it is especially precarious for freelancers who are really not getting jobs at this time. Some people are, of course, but it's difficult to go by, and that is a financial problem, but that also causes a lot of stress. So would you
Yes,
say something?
I empathize with the questionnaire who has raised this point. It is difficult for a freelancer. Um, uh, Depends on what freelancing you would like to do, and so I think one of the ways which people thought of coping, some of the people I interacted with, many people thought that it might be a good idea to have an alternative skill anyway for life. So when you're freelancing about X, having developed some skill Y, and uh, you know, uh, it's absolutely crucial that we think in terms of that this too will pass. So this is time limited. This will not go on forever. So opportunities will arise, and be hopeful that there are times. Yes, there would be an impact on the economy, broader economy, and probably it will affect the job market. But this will pass one day. So biting your bullet for some time, and then having an alternative sort of profession which can be done at this stage, and learning a new skill might make give you more opportunities in future. So I would take it in that spirit.
Mhm. Thank you for that. And I would come to our last question. Uh, a lot of community support groups are taking new initiatives, which I very much appreciate. Like just Adda sessions where you can just log in to the Zoom room and chat. People are singing. Uh, so these are not medically guided always, but I would say they are social artistic interventions, which are helping some people definitely, like people who do
Of
not
course.
have a chance to talk to. So, but these groups, a lot of them are seeking support from psychiatrists and counselors. So, would you what would you say to them? Like, what are the do's and don'ts for such community support
Okay.
groups?
So if I understand, your question probably has two parts. One is that in a joint social activity, is that useful, and what how do you frame that activity? So I think there are few guidelines about a joint support group or a joint activity. See to it that everybody has a say, and if there is somebody silent, the person who facilitates the group should be willing to look out why is the person. That could be the inherent style of that person. So that's okay. Not everybody talks all the time. Then to engage everybody else in common discourse is an art. It's hard enough to talk to one person, but talking to a group of people, sometimes it requires some amount of skills and practice to be able to incorporate and engage everyone together. So if you have an activity, that's easy. So if you are, say, doing origami or something like that in a joint way, and that's absolutely fine. It's okay to do. You if you are emotionally supporting each other, you do need to understand where the threshold is. Because if somebody, you feel that there are enough material about depression, anxiety, or mental health problems. So if these are in oncology, we have something called distress thermometer, and I think that's very relevant. So if somebody is distressed, say about finances, or childcare, or their illness, something. So on a 0 to 10 scale, if the distress is about 4, 0 to 4 somewhere, I think sort of community interventions and speaking to friends, these can manage. Whereas 4 to 6 might require a little bit of more specialized input. And somebody whose distress is between 6 and 10, I think it's more important that they need some kind of professional help. 10 being the worst and 0 being no problems. Nobody is at 0. Meaning everybody has some distress. So I think when people say 0, I tell my patients that you don't need to see me. I am more distressed than you are, so it's okay. This is the time when I think we should say goodbye. And so nobody is at 0, and normal stress can go up and down a bit, but knowing that when you don't overstep the mark of being a mental health professional, if you're not trained, that's also important. There are legislative issues, and you might not know the ways you to help that person. So there are lots of websites and helplines which are actually professionals are providing, but free of cost. So you could even access those sort of things, and or your local doctor, or school, school counselors and things like that, in your organization if there is a psychological service. So I think for mental health, that's it. For if there is chat groups and there is physical health issues, again you need to have a triage. So all I'm trying to say, having a triage system, red, amber, green, so where the threshold that you could function, and having a clearly laid out plan where if things are sort of beyond what you could handle, passing it on to someone who would be able to handle it better. So I think that would be my suggestions, broad suggestions to people who are running these groups. But that's okay. It's you cannot medicalize life, so it's important that the community comes together and supports each other. And that's incredible that people like you are doing that.
Yeah. Thank you so much, Dr. Datta. And we said we'll talk for 45 minutes, but we have actually talked for almost an hour, just 1 minute to go. And yeah, so we are right on time. And I thank you for spending so much time with us. And this was really important. And I hope I learned a lot. And I hope some people who are listening also enjoyed the session and got some
Thank you so
answers
much
to their
for
questions.
inviting me.
Thank you. iNovocare Health of Solutions. Thanks to them for organizing this. And I understand that I don't quite know how to log off, but I think it's that leave studio button there. So thank you to everybody who have been watching. So we are signing off now. Bye.